name is Stephanie Hickey, and for this assignment, I chose to review some of the articles that were published in a book that I found. And the name of the book is Intervening Early in Psychosis. And there were multiple articles within the book that I found very interesting and that tied into some of the readings that we had this week. The reading from chapter 15 was very interesting to me. All of the readings that we did were interesting. I found them to be very informative, but chapter 15, because it talked about this multi-family approach, the psychoeducational multi-family groups approach, I just found it to be very hopeful and beneficial, how it talked about the things that therapists can do with families, especially if they detect the psychosis early on. And this situation, the case study that was talked about in chapter 15, I also found to be very hopeful. So I think after reading the first few chapters, the self of the therapist issues for me were just as a person who tends to worry a bit about things, just worrying that would I miss the signs? Would I miss the signs in a client? Just, I guess, self-doubt and just lack of confidence in this area, because it's an area that I'm not very knowledgeable about, but also seems like an area that just is so important to be skilled and to know what you're doing. So for me, it just, as I was reading this week, I found myself feeling like, would I be able to treat this person? Would I be able to help this person through this situation? Would I be able to identify if somebody in my life were going through this? It just brought up a lot of kind of anxiety over between my family and between just young people that I work with. Would I be able to see the signs, and would I be able to help them either as just a concerned family member or teacher or mentor, or in the future, would I be able to help these people as a therapist? So again, the book that I found that I would love to have more time to read more thoroughly, there were 3 different articles that I found within the book that were kind of in line with what we read about in chapter 15, that family approach that could help people if you catch psychoses early on. So in the first article, it was called Early Intervention in Psychosis, and it was written by Dr. Patrick McGorry. I liked it because in this chapter, he talks about these core components of early psychosis service. So again, tapping into some of my personal issues, where what would I do? How would I handle this? Would I be able to detect it? I like reading things like this. So he talks about, if it's early detection, you could do community education to improve awareness of the young person's mental health issues and those who are working with young people, which again, I think helps with that stigma and that fear that kind of shuts people off. Early detection would also be easy access to service. This idea of one clear entry point with a no wrong door policy, and then also home-based assessment and care that would be available through a mobile multidisciplinary team that could provide triage, assessment, crisis intervention, and home-based acute treatment. So that would be for early detection. For acute care, it talks about access to subacute care, acute phase care, so that's by a mobile team delivered in the community, brought by they talk about a youth-friendly inpatient unit. For continuing care, there's case management, medical interventions, psychological interventions, which again talks about that psychoeducation, the individual psychotherapy, the cognitive behavioral therapy. And then it taps into that group programs idea. So that youth and their families could come together and they could, um, it talks about enhancing psychosocial and functional recovery. The focus would be on topics of interest to young people, with issues related to stress management, coping, anxiety, drug use, school, work issues, things like this, because um, as we've read and as we've heard from different people, um, when you get in there and deal with some of those other issues that may be presenting, that can help with the psychosis. So, again, in continuing care, in this chapter, it talks about family programs, youth participation, workforce development, and just all of these things that, again, probably because of my self-therapist issues and my worry and my fear, I'm really drawn to articles like this that have this kind of, what can we do approach. So that was the first article in the book that caught my attention. The second article in the book talked about, again, it was this intervening early, and it was a team-based approach. So like we talked about in class last week with the multidisciplinary approach, it tapped into that idea that using people from creating a team where people have their different skill sets can come together and help these people who are dealing with psychoses and help their families. So this article talks about how a team might be able to implement 4 dimensions of recovery. So it talks about health, and the team works with service participants and their families to make informed decisions to assist individuals in managing the symptoms. So again, going away from just that coercive, forcing people into something, it has these discussions with the family. The second dimension that it talks about is home. So it says the team helps individuals and their families with concrete case management services, including assistance with insurance, entitlements, and a stable and safe place to live. The third component, or the third dimension, is purpose. So all members of the team work with the service participant in order to clarify and meet personal goals around work and or school. And the fourth dimension of recovery is this community dimension, which talks about the team being responsive to participants' preferences, and regarding their desired level of interaction with family and friends. And it talks about this multidisciplinary team also encouraging the development of relationships, including involvement in community groups that would foster support, friendship, and hope. So again, for me, this week, I enjoyed learning about, I feel like every week I'm learning about such important aspects of being a marriage and family therapist. So I appreciate these articles that give suggestions and educate me in how to handle this. The final article was Family Intervention and Support in Early Psychosis, by Dr. Shirley Glynn. And I liked this one because it talks about some of the ethical issues that might come up in doing this. So while there are all these good ideas, it does talk about that some young people or some youth might not want their family members involved in treatment. So it talks about a small subset of individuals might be reluctant to have their relatives involved in their care for all sorts of reasons. They might have this. And then the article goes on to give some suggestions about how some strategies that might be helpful if you do get in a situation where the person experiencing the first episode of psychosis or later episodes, things that you can do to help them reconsider their decision without forcing them to make a decision. So again, I look forward to listening to everybody's responses and seeing what everybody has to say.